So, as Patrick said, I sit across multiple fields, primarily public administration, public health. So I tend to do my primary research in issues relating to social policy, like the implementation of our National Disability Insurance Scheme, which is the biggest reform in Australia since 1970, so since we introduced universal healthcare. And then draw out lessons from that for what public health is doing. So it's a really interesting place to be at the moment where Patrick and I occupy, because public health is venturing more and more into what we would actually think of as public administration and to a slightly lesser extent political science. And this is happening because public health is trying to grapple with questions around the social determinants of health. If I can get crazy with that. So I'm sure most people here are familiar with it, but the big question facing public health now is, how do we affect change in the diverse areas that impact health, that work independently of one another, when a lot of them don't even realise that what they do has an impact on health. So things like education, social welfare, housing, that type of thing. The issue, as I see it in public health at the moment, is that we're not engaging enough with disciplines that can actually help answer this question. So what I thought I would do today is talk about how we can rethink some of the popular global public health movements from a public administration perspective. And in doing so, I'm going to show that they're not as likely to be as effective as public health people believe they will be. They do need some refinement. So it's a slightly controversial thing to say in public health. Not Patrick, no. We're of one mind on these issues, us and 10 other people in the world. So I'll say up front, public health does have a very long and successful history of securing policy change for better health outcomes. But there are some key differences between the types of policies we have been advocating for changing legal policy.
Sorry to interrupt you for lunch.
So there are some differences in, arguing for tobacco legislation change compared to the kinds of things public health is starting to argue for now. So there's two initiatives I'm going to talk about, which may be familiar to people in the room. One is health and health policy, it's referred to as HIAP, and the other one I'm going to loosely refer to as the fairness agenda, which is something that's being advocated for by Michael Marmot, who is the leader of social and health research. And my colleagues and I, in a paper we published about 18 months ago, we argued that these are examples of what we called instrumental process-based interventions, very long fancy title. So we call them instrumental because they're not being proposed as impacting health directly. It's more that they're going to change something that will then change health. We call them process-based because the thing that they want to change to then have health outcomes is processes of government. And then I'm using the word intervention quite deliberately because these initiatives like HIAP are designed to disturb the natural order of policy making. So they're introducing new structures and new processes. And that's Penn Paul's definition of a public health intervention, and I think we can apply that to these at the level of government, even though it's usually used around community level interventions. So if I do just a really quick review of both of them for people who aren't totally familiar. So the idea between HIAP is that health is driven by the activities of groups outside of the health sector. So healthcare now makes up only a really small amount of what public health people would call health action. So housing, employment, welfare all driving health outcomes to a greater extent than healthcare systems are, because basically the horse has already bolted. Is that an expression I'm going to do? Yeah, good. So HIAP's been pushed by the WHO. It's been adopted last count, I think, 14 countries, either a local, federal, state level. And the WHO is quite prescriptive about how HIAP should be implemented. So people will say yes, there's local kind of adaptation, but when you look at the WHO documents, they talk about having a central interdepartmental team that's situated in a central agency like the Privy Council Office here, Prime Minister and Cabinet, where I'm from, and they play a coordination role. And the idea is that they're going to get other agencies to think about the health impacts of their policies wherever they are across government. And to do this, they should encourage all departments to use health impact assessments in other terms, which is a planning tool designed for public health. The fairness agenda, which is not its official name, but it's a name we've loosely given it. This is a set of recommendations for action on health inequalities that were put forth in the UK Review of Health Inequalities by Michael Marmot. So the review called for a whole of government response to health inequalities, which should be created by securing robust political leadership, coupled with interdepartmental team, so a bit like HIAP, that's going to facilitate integrated policy, and it would report to a single director. As part of their work, this interdepartmental team would encourage the use of health equity impact assessment. So it's just a slight variation on a health impact assessment. That's looking at the equity outcomes of a potential policy. Worth mentioning as well that health impact assessments and health equity impact assessments are planning tools and not implementation tools. And the idea is that it will help policymakers see the impact of their policies on the health of different groups. So the idea is that we will stop widening health inequalities and will hopefully reduce them. So the fairness agenda is seeking structural integration between departments. It's seeking process integration through the use of these assessment tools in planning. And it's got a centralised model. So the agenda and the tasks and the processes are all set by a central task force. Alongside this, Michael Marmot, on his various speaking tours and in his commentaries, has argued that policymakers also need to put the concept of fairness at the heart of all policy development and delivery. And so by doing that, we will address social inequalities. As a side note, Australia has this very strong history of talking about where the land of the fair go, everything's about the fair go, and if you look at our policies, they're anything but fair. So I would highly question whether or not fairness is a particularly good guide for policy. But anyway, the idea with Marmot and fairness is that fairness is going to act as what we would call in public policy a type of policy narrative. So it's something that's going to unite different parts of government behind a common goal. So if we go over to public administration, we already have a term for these, what we're calling IPIs in public health literature, which is joined up government. So here, horizontal government, I still haven't quite got whether horizontal government and joined up government are exactly the same, because joined up government can be about vertical integration. Is horizontal government sometimes about vertical integration as well?
Well, Luke has written on it, but I guess I would say depending who's using it. So horizontal in Canada typically means at one level within a government, but sometimes it has a more expensive meaning.
Okay. So joined up government, whole of government in Australia will be across government. It'll also be layers, and it will include non-government organisations as well, because non-government organisations implement a lot of policy through program delivery in Australia. We've done huge amounts of de-evolution of government.
So only those those organisations involved in program delivery?
That's a very good question. I think now it's loosely referred to.
Okay. Sorry.
Any kind of network governance
Cool.
arrangement is joined up government and whole of government now. Whole of government is maybe used a little bit in a tighter sense to talk about what's going on just in government. Joined up government is always very broad.
I have the paper that there's a couple paragraphs that you can send you right.
So with my public administration hat on, I would say that both these public health initiatives are joined up government initiatives. Joint government initiatives tend to include structural change to government. I will say something that also got to learn in last year at being in Canada. You don't do structural change to government nearly as much as we do in Australia. We do it continuously. It's notoriously unsuccessful and difficult to implement and highly costly. So joint government or whole of government approaches have been attempted in many countries over the last 20 years to address wicked public and social policy issues. So the idea is that these issues implicate multiple departments, and in Australia and places like the UK, also lots of actors outside of government. So we need to find ways to integrate and coordinate what they're doing. They're thought to promote agreement, collaboration, straighten out inconsistencies in policies. What's really different about these public health interventions, and why I call them interventions and not just another whole of government initiative, is that they are being designed by people outside of government. So that is unheard of in public administration. Grown-up government initiatives usually come from the government of the day, not from academics or people sitting outside of government saying, we think you should do X and change all of your processes in these ways. Joint government is an umbrella term, so how it's done depends on the characteristic of the government, what the political imperatives are, the nature of the problems that are being addressed. One of the consistent findings in the literature is that there really is no one-size-fits-all model, which is really interesting. Again, when we go back to the public health interventions and think that they're quite prescriptive in what they're suggesting. And my colleagues, Janina Glynn and Fiona Buick, who I think you read a bit of, who write a lot about joint government in Australia, they have said that really this is this beautiful term that masks a whole lot of challenges and barriers, and that we really need to have a lot more sort of close attention to this. So currently, joint government is highly variable in its outcomes, and it's no guarantee of success, although it's often treated as though it's a beautiful panacea to problems. So given that we have an absence of core principles and methods and huge variability in outcome, in public administration, there's some growing interest now, how do we get whole of government approaches created? So what are the principles and the methods and the instruments being used? And how appropriate or effective are they actually in combating the problems that they set out to address? Because the evidence at the moment is that they're often not very effective. So my colleagues and I undertook a systematic review of all the empirical studies done that we could identify on joined-up government around the world. We were guided by these two questions when we did it. And this was an attempt to draw out some lessons about what makes for success and failure. And because I know Patrick's always interested in my publishing strategy, we published one version of this review in its long form for a public administration, and then we did a version of a systematic review for a public health audience that wrapped it up in this kind of explanation of what joined-up government is and how it relates back to what public health is arguing for. So I'm going to talk through what the results of our findings were. We identified around 1,500 papers. In the end, I think we got down to about between maybe in the 20s in terms of actual empirical studies into joint-up government, and we defined that in terms of, was there some kind of qualitative or quantitative research, whether that was evaluative or explorative, into the initiative. And we identified 6 areas from that literature that provided some indication of success. So we found those 6 areas were the operational level, the nature of control, whether it had a top-down or bottom-up focus, the instruments being used, and the membership. So I'll just talk through some of those, and then what I'm going to do is compare what we're doing in public health with those, so we can have a look at how robust public health interventions are. So first off, we found that joint-up government initiatives that target multiple areas for change are more effective. So those that are working within government at a strategic level, so going back to that kind of central agency question, but also push down through line departments to service delivery and often to NGOs as well. They were the ones that were more likely to have an impact. For them to be effective at these different levels, they had to be both top-down and bottom-up. So they had to be pushing for integration, not just because somebody at the top of government said, yep, we want to do this. It's important to set goals and have targets and have clear incentives that are determined by high up in government, but there had to be an interest in it at the lower levels. So you had to have that collaboration and willingness for collaboration and a lot of planning. And that's talking about lower levels in government, but also NGOs as well. So we found that they were decentralised, so they weren't driven by a single unit or authority, which is consistent with that idea of a dual top-down, bottom-up. You've got to have this appetite for change across the different administrative layers. They were designed not just on the basis of what they wanted to achieve, but also in the context in which they were going to achieve it, which is really critical when you think about the public health interventions that are designed on what they want to achieve, but not on the context. They used a really wide range of different instruments that aimed to create changes in the structure of government, the processes of government, but also importantly culture. And really interestingly, they changed instruments at different points of implementation. So that's something, so a lot of my work is straight implementation research, and that's something that I've seen across a number of different studies, is that we're really, really good at setting things up and creating new things. We love new shiny things. We are really bad at changing those as we progress. So the thing that starts off a joined up initiative might be a task force, it might be a political sort of commitment to something, but that might needs to change as implementation progresses. But there's an unwillingness to kind of have that flexibility during implementation. We tend to stick with the instruments that we defined at the outset, even when the evidence keeps mounting that those are instruments that are not working very well. So if we're going to sum up what makes for a successful joined-up government initiative, you have to say they've got to be dynamic. They need to be activating lots of different leverage points. They need to be fluid and flexible, because if we think about it, joining up, creating integration, that is a dynamic process. So the instruments and tools that we use to do that ought to also be dynamic as well. So I'm not sure if you can read anything on that screen. I can't from back here. Hopefully you can. Maybe I can blow it up a little. Is that a bit better?
Yeah.
Mm-hmm. Okay. So this table provides an overview of how our current public health interventions that are being pushed globally stack up against the characteristics we found in the public administration literature about what is and isn't successful. So first off, if I do this, it might, zoom back out. We'll do a bit of zooming and resuming. So first of all, both interventions put a really strong emphasis on gaining high-level political support, which is we found to be important. Slightly less favourably, so we keep zooming out. They're very focused on change within government at that strategic level. They're highly centralised, so that doesn't stack up as well. Now, I think some proponents would argue that these interventions that are just about what can be done in government, working just at one or two levels, not thinking about policy networks, which can include NGOs and a lot of other actors. What we found was that when you have interventions that do that, or joint government initiatives that do that, they tend to wash out. So there's a bit of interest, but there's no kind of sustainable change. I did a large study on Australian social inclusion agenda, which was a really big social policy reform agenda of joint government that was highly centralised, and it didn't get included in the systematic reviews when we published at that stage, but it ran true to that as well. So NGOs got very excited, we've got this big thing, it's called social inclusion, we're going to do something, and then they waited, and nothing seemed to come, and then they gave up and did something else. So we have this phenomena where they don't really push down to the lower levels or succeed in bringing other people along in this vision for change. So Robin Keyes, collaborator of mine, says in her research, while top-down approaches are important to set priorities and push through a joined-up ethos, cooperative relations on the ground may prove to be more important in the long run in actually creating change. Again, generally research has shown that initiatives that are focused at this higher level, that are centralised and top-down, actually struggle to keep change and the momentum of change within government itself. which was a bit of a surprise. So specifically, they haven't been able to break up programmatic and departmental silos, so your horizontal government. And within the leadership group, there's often very little impetus to incorporate the views of people outside of that very authoritative core, which might be, say, a task force or a group put in Privy Council's office. Similarly, zoom out. You're going to go back and say never use present. Similarly, interdepartmental groups have become a must-have of joined-up government. They are set up all the time in Australia. From chatting to people in PCO over the last few weeks, I gather that that's something that happens in Canada quite a lot when you've got an issue that has political priority. You bring together a group. It's meant to push through change. The empirical research suggests that these groups actually limit integration and collaboration, the exact opposite of what they're meant to achieve. And that's because they end up creating these really expensive new teams and administrative structures that aren't integrated properly into the existing departments. So you get this separation where you have line agencies who have to keep doing all of the grunt work, and then you have this little team up the top that gets to do all of the policy work, but they don't have any kind of accountability or incentive mechanisms to make the line agencies do what needs to be done. So they become quite isolated. You can see this with HIAP in particular, where there are no mechanisms to make sure departments collaborate with the central task force. It's all built on relationships. So that's very fragile. The separation that can be created can be a real strain on these relationships as well, because what we found in the literature is that there's this sense that there are these people who get to swan around and come up with great ideas, and we're over here having to implement everything and doing all of the hard work. So it can actually create a lot of hostility. Under all, what tends to happen, and this has definitely happened in the Australian case quite a lot, is it undermines the whole initiative because it makes the joint government initiative really vulnerable to budget cuts. Intergovernmental committees are expensive. If they're not seen as being able to make things happen, they're going to be cut. So if we're going to avoid this, we need our interdepartmental groups to be supported by really strong structural links into the rest of the bureaucracy through good accountability mechanisms, whatnot. The literature on joint government emphasises that initiatives need to be fit for purpose, which I sort of touched on before. So this means they need to be developed in response to both what the goals or the purpose is, but also the context in which they're being implemented. So I would question the Zoom. I think we have to question the compatibility and transferability of these different public health models across very different structures of government. So I'm going to pick on HIAP because it started in Australia, in the state where I'm from. It's a highly structured intervention. It was designed within we're thinking about the South Australian state government, which is a really small government. So the idea that we can take something from there and then we can implement it at a federal level, or we can implement it in an entirely different country, that's tricky. And the literature from public administration is suggesting that it's problematic to be thinking in that way. And go out on a limb here and make a broader criticism of public health. So I think public health is really good at identifying problems. And it does that beautifully through epidemiology. What they're not very good at, is coming up with the solutions. And what I think there's a tendency to do is create solutions that are the mirror of the problem. So health is connected by a set of interconnected factors that are a responsibility of diverse people. So the answer to that is that we need to join up all of those people responsible for that, and therefore we will have a solution. The theory of the problem is not necessarily the theory of the solution, which is really important to remember. So we need different types of research and understanding to develop that solution. So we need to know about the context, and in this case we need to know about how government works. So, I often see with HIAP, it said that, HIAP is based on evidence and that's why it's going to work. But HIAP is based on evidence about social terms of health, how they play out at a population level. It's not based on evidence about how you change things in government to create outcomes. It's not based on public administration evidence. While we're thinking on HIAP, a couple of other points to consider. HIAP has a much narrower focus than most joined-up initiatives. So, most joined-up government, horizontal government initiatives between departments, they have integration as a kind of two-way. So, health with transport and education, but also transport and education are being linked up. What HIAP is seeking to do is link health in a fairly kind of, individual way with each department. So, in some ways, you could argue that HIAP's actually going against the very principles of joined-up government, which is aimed at holistic, integrative thinking. It's far more linear and simplistic, I think, in its approach than a lot of initiatives that are emerging from within government themselves. Secondly, and I'm not the first person to say this, HIAP relies on making health a priority of all government departments. Policy outcomes emerge from interactions between different stakeholders and decision makers, all of whom have their own priorities and interests and, quite frankly, their own problems. So Exworther and Hunter, they might have been the first person to say it, they summed it up well when they said, it's presumptuous to think that health might trump other equally compelling, deserving causes. So while it's important to create cultural change around what government is trying to achieve, here maybe fairness has a better shot than health. It's something that people rally behind, but as I said, coming from the land of a fair go, where we're doing anything but treating people fairly, I'm not sure that's the best principle either. And then again, just to re-emphasise that, all of these studies that we looked at, they were interventions being driven from within government, and they were still coming up against all of these challenges. And so there is another layer of complexity being added when you've designed initiatives, without knowledge of context of government, like what's happening in public health. Okay, I'm going to stop being quite so negative. What can we do? So Janina Flynn and my colleagues argued for this idea of maybe we need a supportive architecture around joined-up government initiatives. And what I think you could see from the slide I had before, if you could read it all, was that, some elements of a supportive architecture are missing. So what this table is we try to think through what would the elements of a supportive architecture for a joined-up government look like based on the research that we did. And we distilled them down to hard and soft. So it's hard to tell there's been no official validation of HIAP or the fairness agenda, which is interesting in and of itself that it's now being pushed by the WHO. We actually don't have any validation of it officially. That makes it hard to know if any of those or many of those soft elements are in place. Can you read that, or do you need to zoom in? From the outside, it looks like more training and skill development is probably missing, both within the teams pursuing the joining up, but also other departments and groups. What is quite clear is that some of these harder aspects are missing, particularly ensuring decentralised control, having accountability and incentive mechanisms in place that link these interdepartmental groups with other departments and levels of government. And also more dedicated resources, so joining up is really expensive, and that's often overlooked by both governments who are trying to implement them, as well as within the public health literature. So in short, at the moment we have a major international body pushing the adoption and implementation of a joined-up government initiative at the federal, state and local level internationally. It isn't well designed when we compare it to the literature that can tell us about the design of these things. It hasn't been evaluated. And coming from Australia, I can tell you that the risks of harm are actually high. So South Australia, where this sort of started with Kick Bush designing it, what's happened, it's been in place now, must be close to 10 years. And in that time, funding has diminished both for health and for health promotion. So what it's enabled that government to do is say, yeah, we care about health. We've got a unit in Premier and Cabinet that's dedicated to health and health policies. Meanwhile, they have ripped funding out of healthcare and out of health promotion systematically the entire time HIAP's been in place. So I don't think that this is benign. I think there are some really high risks. Now, you perhaps would agree with me that if we were to properly conceptualise HIAP and similar initiatives from a public administration and political science perspective, rather than bundling them in with more traditional public health efforts to enact particular policies like tobacco laws, it actually shifts our analytical focus and our research in a really important way. So instead of tracking outcomes, it's focusing our attention on the processes of government and the ways in which interventions interact with and affect those processes in both anticipated and unanticipated ways, from which outcomes for health will emerge. I think it also encourages us to see government as a very complex and contested space, which it is, and we need to properly investigate that and understand that. So that's it for me.
Okay.
Have a good chat.
So, for the presentation, does anybody have any questions about the presentation itself? Anything about us?
I feel I have to represent the universe of public health.
Go for it.
Without feeling defensive. When you made a few comments about, public health, and I just wondered who you actually meant, because it's not like a homogenous.
Oh yeah, and I should say public health, people working in social determinants of health, pushing for policy change. It's not the world of public health. Very difficult.
Because those folks are worse.
Just a bit that I engage with. Okay. Which is why I was going to say at the start that, public health has an amazing history of transformative policy change. Australian smoking is a wonderful case study. That is not that we haven't been successful, it's just that we're treating what we're doing now in the same way we've treated our past successes, and we're actually trying to do something fundamentally different, which means it's probably not going to work unless we recognise that we're doing something fundamentally different.
So I guess what I'm a bit unclear about is what the goal is for joined up government. So it sounded to me like what you end up kind of calling for is really process without an eye on the ball of what the objective is for it in the first place. So the public health people are after a particular objective. But then at the end of the day, doesn't it depend on the objective whether or not joined up government is successful or not? The objective surely can't just be joined up government, or are you arguing that is in fact the objective?
No, there is an objective.
And what's the
As well as
objective?
that. And that can be different. So in Australia we've had them in housing, crime, domestic violence. I was saying to Patrick, I had one interviewee say, we got really frustrated one time because we had our joined up government initiative ready to go and we got trumped by another one that got more political attention.
Battle of the joined up government.
Yeah, like you're getting these horizontal silos all of a sudden.
But in Canada, we've had them for official languages, climate change, housing, homelessness. So every government does.
Yeah, no, but my question is whether or not one is assessing the success or not of joined up government. I can see that in your paper, like the connection between the specific objective and your analysis. So how can you tell whether or not joined up government has worked, right? Unless you really focus on the objective, whether it's crime reduction or it's tobacco cessation or...
We were relying on the descriptions within the empirical case studies about whether they felt that it had worked or not.
Is that okay?
Can I add a question, John? Add on to Colin's. You mentioned at the end that, I thought I heard you mention that instead of an approach that focuses on tracking outcomes, you're presenting an approach that looks at processes of government. But as Colleen said, if you're looking at the criterion of how does it work, does that not come down to tracking outcomes? And my question is also informed by the fact that our current government is enthralled to this deliverology idea, which, as I understand it, has a lot to do with tracking outcomes, and I'm not sure what else it's about. But
I'm not saying abandon tracking outcomes, because otherwise we've got no idea if anything's working. It's just that kind of focus just on outcomes. So there's an idea that Diane Feinberg, who is a Canadian, has talked about in terms of systems research, where we often set targets and goals that are numerical, the outcomes. But could we also think about, alongside those, having functional goals? So we want this process to be functioning, playing this role, functioning in this particular way, and whether that shifts the gaze to implementation. Because although outcomes are obviously important, if we don't get implementation right, we'll definitely never get the outcomes. And certainly in Australia, but actually internationally in public administration, for a long time we've forgotten about implementation, and a lot of this is about how you implement changing processes within government. So it's not to say either or, it's to say both, and we're missing one at the moment. And going back to your point, I do think that there is a really important interplay between the kind of policy issue and the processes, and we didn't tease it apart in this study, and I have in the kind of, so I tend to do like big policy implementation studies in real time. And they're places that I look at the interplay between those two things, and I can see that it has an impact on it. But for the sake of this particular piece of work, we didn't do that. So some of the papers that got included in this did talk about, some outcome statistics. Some of them just talked about these were what appeared to happen with processes that worked and didn't work. So just the limitations of doing kind of systematic review of other people's already published research.
Although you come to quite big conclusions about what should happen as a result, so that seems to me to be, it's actually, I think, problematic. So if, for example, the concern is around the link between like public health aspiration of fairness and then linked up government. I mean, wouldn't one want to try to develop maybe some metrics for what fairness should be? And then see whether or not linked up government has got any kind of relationship to that.
No one's doing that.
But I kind of presume, doesn't that kind of presume that you've got very good cases of effective joined up government in the first place?
Yeah.
I think the point of this literature in part is that, presumably if joined up government leads to better outcomes, it has to go through effective joined up government. So it'd be great if you had effective...
It might be that bits of joined up government are the bits that are really important that actually make the change. Why is it this sort of idea that it's some kind of holistic, perfected, theoretical idea of linked up government that is the only way you get change?
But the empirical literature doesn't make that. The empirical literature simply says when we do individual studies of individual policy change initiatives using joint government kind of techniques, they tend not to work. And then when they do work, there's certain things that matter, and so we should pay attention to those things that matter. So we have lots of empirical research that makes the point you just made. Sometimes it works, sometimes it doesn't, here's why. This is an attempt to say, in general, what do we see? And then how does that compare with some of these other processes in public health?
I do agree with that point, but in the sense that I respect and understand and appreciate the overall idea here, trying to sum up the literature as a whole, but it's rarely a case where a changing government process will work or not work. I mean, it's some aspects work better than others. I mean, it's difficult, I think, to actually decide which cases did not work, which did work. And certainly, I haven't looked at this literature in a long while, but in the work I did in the past, I mean, things were a little bit, it didn't work very well overall, and certainly came far short of expectations.
Yeah.
But that doesn't mean that there weren't actually some progress made on some key issues through, this partial success. And that's harder to capture in a study like that, obviously.
Yeah.
Well, go ahead.
There's this really interesting question about the kind of epistemological nature of studying wicked policy problem is that you do it through single case studies. Every wicked policy problem is different. Every context is different. So in some ways it can mean it's very hard to draw commonalities between them, which is what this is trying to do essentially. Because that's been inclusive in the public administration literature, is that when we look at this stuff, we have a lot of single case studies. So.
And part of that literature is also a lot focused on lessons learned, which to a certain extent are specifically lesson learned for that specific case.
Yeah.
So my question was about the 20 studies that you selected out of the 1,000, or so what were they were all in public health, or?
No, so they were not. In fact, very few public health ones are in there because they're not evaluated. So they were across really diverse issues, diverse kind of countries, diverse levels of government. So we didn't include anything in our supportive architecture that didn't have sort of multiple studies hadn't identified it, to try and get over that n=1 problem that we tend to have with this stuff. It's interesting in itself that out of how many joined up initiatives there would have been globally, we could only find 20 empirical studies. It's quite crazy to me, coming from public health, where we're so heavy on empirical research.
Can I ask a question about the populations who are targeted in any of these kind of interventions? Because it seems like the missing piece for me is maybe the joined up initiative is a complete disaster, but it's not owing to the process, the screw up a lot in the joining up, but really about how joining up actually can distance you from the populations you might be trying to intervene if you're sort of identifying two populations. I just thought of Indigenous people because you mentioned fairness, where I think fairness is very inadequate in talking about Indigenous health, because we know that, well, all the stuff we know about Indigenous health outcomes in Canada, I'm sure you can speak to this in the US, in the Australian context. So
They're worse in Australia.
yeah, so in that sense, let's say there's lots of bluster about initiatives, whole government approaches to dealing with issues affecting Indigenous people. They might fall off the rails for all kinds of reasons that have nothing to do with joining up. So are we looking at the wrong kind of independent factor in that sense? I don't know. I guess I'm having difficulty understanding what you sort of blame or where you sort of target your concern without an appreciation for what exists outside of government.
Yeah, and I guess...
Sorry if that's not a clear question.
I think I understand the question. I guess that's my bias as a public administration researcher, is to look at what were the processes in government around this particular priority the government had that it didn't work. One of the interesting things that I found in a study that's not included in this was that when a joint-up government initiative wasn't particularly successful, so organisations who are working with community groups were waiting for change, waiting to be engaged in a different way, and it never happened. It actually had really serious ramifications for what they would do next time something came along. So they said, well, we've seen this before, we're not bothering this time. And so every time we try and launch a joint-up initiative around a particular issue and we don't follow it through properly in a process way, we are making the job harder and harder for ourselves down the track, because people get reform fatigue and they're getting jaded. So if that's happening at the NGO level, I can only imagine how extreme that is within communities who are continually targeted for policy by policies and governments for change.
Thanks.
I was wondering if you could look sort of at the flip side and see if there's ever cases where something good happened in an unexpected area. i.e. that the joined up government structure, whatever it didn't work, wherever it didn't work, but if somebody who's never been interested in say, social determinants of health, for example, it's somebody who's never been interested in that, suddenly did something good, wouldn't that be a way of sort of finding out ways of thinking of the overall, even if it wasn't a success,
Yeah.
that there was some good policy from somebody who'd never done anything good in that area, never been interested in it.
Yeah,
So could you look at that and sort of see that that might be a way of countering the sort of, yeah, they never work, but occasionally they produce a good policy?
So sometimes they do, it's not that they never work.
No, I don't mean that, but generally speaking, there's lots of problems with them and they don't.
Yeah, and
But
sometimes the
it
same
shows a
initiative
jewel
works.
of an unexpected, somebody's never done anything interesting in that area, who suddenly gets, for whatever reason, and trying to figure out the reason maybe of who got excited about that. So at least you could prove that in policy terms, there was actually a good policy that came out of it, which we wouldn't have expected from that actor in that context.
It sounds like a version of positive deviance. You know, in this midst of all this thing not working, why is that working? Why that should not be working?
What's the outlier?
Yeah.
Yeah.
Now, I guess in Canada, as I listen to the presentation though, more likely is a whole bunch of actors who are not aware of an issue or a frame become aware of it. So in the late 90s, the Chrétien government did a big push on homelessness, raised the salience of homelessness initiative in Canada. A whole bunch of departments who would have never thought that they had a role to play were all of a sudden told, no, actually, you might have a role to play. But I would have thought the gist of this research is to say, that's good, but there's still a lot of frustration, because when we don't necessarily give people the tools or the architecture to actually act on that awareness that we've raised. So we have these top-down things, and we do them all the time. We raise the salience of the issue. A whole bunch of people who weren't aware they might have a role realize they have a role. But unless we give them the public administration tools to actually do it, so good things have happened.
Now, what would be those tools, Patrick? Erase income inequality? Like,
Well, I can give you a very
Yeah,
concrete example.
okay.
In government, we budget by department. Typically, these kinds of things involve multiple departments, if not multiple levels of government. Our budget rules about raising funds at the departmental level are so strong that we often starve these initiatives because we can't raise the funds on a sustainable basis to fund them, because we all revert back to the departmental model. So the tool would be a ring-fence budget that I can actually control and is in my A base. That almost never happens for these kinds of initiatives. So that would be a concrete example.
But I was actually talking about a much lower level of innovation that doesn't even need much, that somebody gets an idea of using existing tools in a different way or whatever. And so I wasn't talking about something as big as what you're saying is difficult budget-wise. I was talking about the little ideas, because it might work local, or just something that within your own resources, you actually discovered that you could think differently about something you were already doing. So it was much more minuscule innovation.
Some colleagues and I, at different times, because we knew each other, were studying the same whole of government, joint up government initiative, and we were looking at it from, I looked at it from Prime Minister and Cabinet right down to NGO level, and they were looking just at the NGO level. And we've since discovered that, we each had a number of case study NGOs, that my NGOs got really jaded because no one was in place, so they didn't have a choice. And their NGOs ran with it. And we do plan to sit down and look what the difference is. At the moment, we think maybe the difference was that mine were based in urban areas and theirs were in remote Australia, which has this kind of culture of you just make do with what you've got and you get on with it and you don't worry too much about what's happening in Canberra compared to the eastern states. So like, there are some contextual factors like that, but that's something that we plan to kind of explore about. Why did this work so well over here and then complete disengagement from the ones based in Melbourne? So.
I mean, certainly from what I've done in the past, I think there is a lot of, from a practical point of view, but also in terms of explaining what is happening or not happening, the need to focus on some practical tools. I mean, I was struck when I did this different studies on, we had 4 case studies, climate change, homelessness, indigenous, urban governance, and a bunch of things, but they were very sometimes practical things. Like, even when people add money in their own budget, they wanted to contribute to a collective effort as a result of a engaged discussion about how we could do better collectively. In some jurisdictions, they could not actually. So the federal government came up with new rules for pooling budgets at that time, so a while back. There was virtually no horizontal reporting. And it was actually not obvious to actually do this, not that it was actually doing it well, still today. But the sharing of authorities, ministers get authorities from specific statutes to do stuff. If you want to do stuff together, intervene in a different way on a particular topic, sometimes you're enmeshed in your own sectoral set of precedents, stakeholder promises, it kind of quickly goes down, in my view, sometimes at these kind of practical levels, which from certainly the interviews we did, gives the people, meaning people who are well-meaning and want to do things together, feel that they have to fight the system constantly. And that obviously doesn't last very long, because essentially the system keeps telling you, no, you're not supposed to do this, you shouldn't be doing that. And anyway, so there's I think that's certainly in the Canadian case, there was a lot of these small instrument things that in the system that did not necessarily require creating new structures but the whole it boils down to a lot of specific rules which are really constraining to individual actors, even if they have the right mindset, believe in the superiority of this approach.
Jordan?
Thanks so much for your talk. I guess, as I said already, I'm working on comparing poverty reduction strategies, and I do this in Canada, where the provinces have started since the 2000s. Most of them have started independently of each other to some degree, a poverty reduction strategy where the goal is, in this case, not to reduce the socioeconomic gradient, but to reduce poverty. But if you look at the kind of information that is being tracked as part of the indicators, there's always health indicators, there's always education indicators, there's always income indicators in there. And what we're finding is that there is, even at a provincial level, with that, there's no coordination, there is quite different degrees of implementation of how do you shape that process. And we find that there is a relationship also very much to the history of, how have all these stakeholders been interacting before. So all this to say is that these whole of government approaches, which is not the terminology that's used by the governments when they're doing this, but it very much resonates with what you explain, is that you don't, they talk about the same thing, but they're doing things differently because of whatever the precedents are. And what we're seeing now is that because those processes are different, you also see that the governance benefits that they're trying to capture with the process might be different as well. A question that I have for you is, and because you're also a public admin background, what is sort of the relationship between the literature on whole of government versus the literature on collaborative governance and performance management? Because you see a lot of those elements coming back in a whole of government approach as well. So that, to what extent are these just different schools of thought, or do they communicate with one another?
I don't think they're communicating enough.
Sorry?
They're not communicating
Right.
enough.
So it's just different epistemological communities that...
Yeah, I think that's changing, at least in Australia. So I'm part of a new centre of public sector research. That named last week. I haven't quite got it in my head yet. And we have performance management people, HR people, implementation people like me. So hopefully we're going to start doing things like bringing that together a little bit more, because I see the performance management people talking about whole of government, but they do talk about it in a different kind of way than I do as an implementation researcher. And I think that very much like public health and public administration need to talk more. It's the same thing. There's this quote, I can't remember who it was from, in one of the studies that we went through. So we need more joined up thinking about joined up government. Which I quite liked.
No, from a purely academic point of view, the literatures on multi-level governance, on performance management, on your term of art may vary by country or by where you walked into the conversation, but you end up studying some of the same kinds of things. For example, in org theory, we have a whole bunch of people who do this stuff, but we don't, political scientists, we don't read it and they don't read us. Right?
Same with project management, I've noticed. So we just employed a project management person. It's like, oh, we're kind of talking about the same thing, but we're using different language.
Yeah, so the program evaluation is that. So I have a question, so it kind of comes through my epi lens. In terms of being able to attribute any kind of effect, any kind of change as a result of this, to what extent did any of these studies, could they talk credibly about it being attributable to the changes that they have made? Because the thing that drives a desire to change how this works is going to change other things as well. And it might be those things that are playing out. How can you...
I don't think from an epidemiologist's point of view, like
I'm listening, so we can't pick RCTs if you want.
Yeah,
Over
I don't think they would have
that.
evidence
I'm
that would
interested in just...
satisfy from an epi point of view. So some of the studies did talk about, what happened with statistically outcomes in particular areas. A lot didn't, which is really interesting as well. So a lot of studies out there talking about the difficulties related to process without linking that specifically to any kind of outcome type research.
Yeah, well, I would say it more strongly. In public administration, it's perfectly reasonable to do a study that talks about, did the program succeed in the terms of the program, but not necessarily ever talk about outcomes in the real world. So you evaluate it on its own terms, and you are splendid ignorance and never talk about, well, did it have an effect in the community? Now, there's a place for those kind of studies, but the risk is that you never get to the $1 million question. Was poverty actually reduced? Or whatever your objection was. So there's a certain amount of that.
Well,
Sure.
in most of the health areas, it would be at least a 20-year, probably more. I mean, you've got to, if you're trying to see if post-secondary education actually changes life's chances and health and whatever, I mean, that's a 20-year study at least. So if nobody's going to say might work, but we'll have to wait 25 more years to know.
And it requires a kind of a vision and a scale that people really do not. Ron Mackenbach and Vicky, they did this big, huge pan-European comparing comparing and their effect on equity. And, it satisfies both the kind of need for that epi bit, but also that kind of big, expansive, let's look at this from a socio-political perspective. So unusual to see that, but it does talk to this. You get a bit of traction on, what's really going on with what seems to be the drivers of reducing inequity at a policy, national population level. But it's not the kind of thing that's easy to do.
No, that does have a whole army of lackeys plugging away and doing that incredible data linkage stuff that he does. But I mean, for me, looking at those studies, I find them very compelling, but they don't tell us about information.
But they're not
So they don't tell
they're
us
not
about
looking
the
inside the black box, and that's the thing.
Yeah.
If you could actually do that kind of, look at that big, highest possible level outcome work with, so actually what went on inside to get those policies. Yeah.
That would be the dream.
Well, just quickly, sort of annoying political science question. What is sort of your underlying theory of the state and sort of the role in promoting, I intervene, because we're conceptualizing public health intervention, but I think what's happening is much more fundamental in terms of the joining up of government and how you could characterize that. I'm sorry, 25 words or less, but what do you think is going on?
140 characters.
What do you think is going on in terms of that relationship and how governments kind of shift from kind of retrenchment away from any kind of real intervention and kind of bring people together and sort of say, hey, this is your problem, figure it out, to a more heightened intervention and surveillance of certain populations? Like, is there something?
Yeah. I can only speak to the Australian context.
Yeah, totally. Yeah.
So one of the things I think we're seeing in Australia, which is fundamentally reshaping our social contract, is we call it the hollowing out of the state, and that's a term that's used in a lot of places, but in Australia it's happening in a very particular way. So we have both a concentration of power at the centre, so policies and everything is becoming extremely political, and then we have huge amounts of de-evolution and outsourcing to non-government organisations. So we have lost a massive amount of capacity within the public sector to do policy design and implementation. And you can see that in, it's a shame you didn't make it to the NDIS talk.
Yeah, sorry.
Where we've chosen, so we're in the middle of, the biggest reform since universal healthcare. And that reform hinges on the use of public sector markets.
Yeah.
So the way that people with disability in Australia can exercise their citizenship and their is through a market mechanism. And I think that says a lot about the way our government is going and its relationship it wants to form with its citizens. The other point on that is that we will be boring people who were at the other talk. We've gone ahead, we're 3 years into implementation of that, we're a national rollout, and we have no clear guidelines on what role the government intends to play in this massive public sector market. And it's looking like it wants to play as hands-off a role as possible, which suggests a completely different type of social contract, where it's not actually particularly interested in equities that it might be developing. It's,
and it's bound to reshape other,
Yeah.
Interesting. Unsettling.
Sorry, that wasn't 120.
No, that's good. That's great. Thanks.
I just wanted to ask a little bit about the role of the division of powers in the Constitution and who's meant to be doing what, and how that kind of reflects onto linked up government. So I teach public health law here, and probably the major theme of the course is the role of federalism, and actually how that makes it very difficult to actually have kind of unified action on any particular topic, because it's actually unclear from the Constitution often who is meant to be responsible for what, for many things that we now consider extremely important. It's not that, it's the problem is that it's one level of government or another. It's just kind of unclear. And so into that lack of clarity, hardly anyone wants to often step, it seems. We do it very well. We see it particularly even with our response to things like SARS and these kinds of things. We have, I think, very, very significant problems, often stemming from the division of powers question of federalism more generally. So how does that kind of, I don't know, I know nothing about the literature around linked up government, so I'm just wondering how often is that kind of discussed or reflected on, or is this another example of where the linkers up need to get more linked up and talk to the lawyers?
It's a good question, because I think that in every one of these studies there would have been different local, state, federal relationships. And this work is 18 months older, and so I don't quite remember the details of it. I think they focused in on whatever aspect they were looking at, joining up some federal and state or some kind of local grassroots level, and I didn't think anybody reflected more broadly. In Australia, and I think probably why we have such an appetite for joint up government is because we do have a much stronger relationship between our states and federal government than you do here in Canada. So policy is really set at a federal level. The states they implement it. You know, the joining up between the federal, the joining up between the federal and the state government is never really an issue. It's the joining up across departments and then joining up with entities outside of government that becomes an issue. Whereas, so we have COA, Council of Australian Government, which I've spent an inordinate amount of time talking about this week with people in PCO who are like, you have what? It's a body, it's a formal body that exists where all the premiers come together with our Prime Minister regularly, and every major reform and policy agenda is worked through, decided on, and how the states will implement it, or how it will move from the states to a federal responsibility, and they sign off on it. And it is one of the differences that I've learned from interviewing people in PCO is that that's not something that we play political football with. So the states might be angry about federal government policy, that'll play out through the media and elsewhere, but COAG is always presented as a united front. So we, the states and the federal government, are doing this. And I gather that's extremely different from here.
Just a tad.
I had a more in the weeds question about the idea of a policy analysis lens as a sort of likely outcome of a joined up approach to an issue. I'm not sure how specific the idea of a policy analysis lens is, but when it comes to this danger of sort of multiple dueling joined up government agendas, I think you often get the prescription to have, you know, multiple requirements of a certain kind of policy analysis lens. I know, like in development, they have to run everything through a gender lens and an environmental lens, and you know, now it's. I'm just wondering whether a joined-up government initiative in service of public health inevitably has to use this idea of a policy analysis lens, and if there are alternatives to that. And if there's been research into what happens when there's multiple policy analysis lens being prescribed at agencies across government to implement it.
There hasn't, and I think there should be. I think it's so important because increasingly, and I see this in all sorts of areas, and I see it on Twitter all the time, and Patrick or anyone who follows me on Twitter seems to get really grumpy about it, where people are like, we need this in all policies, and we need that in all policies. It's like, well, you can't have everything in all policies because that defeats the point of policy, and you can't have everything in every department because governments actually have to function, and that requires having departments because that's how government functions. So again, this comes back to this sort of like misunderstanding maybe of the way governments work, that you can't have everything in everything. I would be really interested, I don't do health impact assessment work, Evelyn does, and it might be something that we could raise with her, about this idea of where policymakers are under pressure to do multiple types of assessment, environmental, gender and health. Do they do them all? Which one wins when they do it, or if they have to do it?
Does any have any impact?
Does it have an impact?
When they're multiple?
What if it comes up with conflicting, you know, something that's good for health is bad for gender or something? How do they rationalise that? I would be very interested.
So is there a requirement in Australia? You would like for every
environmental assessment?
Yeah.
Impact assessment is standard. There's a huge industry in health impact assessment. And I use the word industry. Okay.
But it's not the requirement. Like in Canada, for example, it's totally effective. But since 1990, every memorandum to cabinet, which is like a basic document used by a Canadian cabinet to make decisions, has to have a section on environmental impacts.
So we have that
Do
for
we have that for
environment.
health? No, just for
Just environment. We do not have that for health, and we do not have that for gender. And so we have people arguing that we should have those things.
Well, to go further, that same memorandum cabinet has a mandatory section on official languages, on federal relations, on gender, and we don't have any systematic analysis. But what seems to be happening is that, and this was my experience when I worked there, is that the analysis becomes perfunctory, right? You just check the box kind of.
Yeah, and I think that's what Kat Smith has shown in her work around health impact assessment. Yeah. And certainly, like I've never studied it systematically, but when I've asked, because I'm in there doing other research about health impact assessments, the feedback I get is it's a tick box kind of tool.
And this is an excellent example, though, where a bunch of people come up with, the people who are interested in gender and public policy, they become periodically fascinated with a gender lens and what it might accomplish, and it's got hardwired into bits of the government of Canada. But if you study it a little bit more broadly, as your question put it, if you say lenses, and then you think about, oh, guess what? A, there's a whole bunch of them, and B, they devolve to less than a wonderful outcome. Well, then that's I think the point you're trying to make, which is we can benefit by situating the particular public administration instrument we're interested in a broader context. So people who like gender lenses, they like gender lenses, or intersectional analysis, or environmental assessments, or health impact assessments. But we need to think of them holistically and find out, well, overall, what happens or not.
Yeah, so it's a bit like the dualing joint government initiatives. We also have dualing assessment instruments. And are any of these things actually leading to better policy implementation design?
So there's an overlap between environmental assessments and health impact assessments.
But then it's the answer that the health impact assessment has to integrate something serious about gender or intersectionality, right? I mean, I think that's the fear, that the health impact assessment will not really reflect, and that's why there are the dueling impact assessments, right?
Yeah.
But they, at some point they overlap. And then these things are flavor of the month, right? So depending on the Prime Minister and Cabinet of the moment, at the cabinet level, different of those lenses get more and less emphasis. So I've had ministers who really had us work hard on the gender lens, and then the next minister, no. Or central agencies care more or less. Yeah. Anyway.
I don't think our current government is caring too much about the environmental impact.
Unless there are any other questions, on your behalf, I want to thank Gemma for her presentation. It's been an interesting conversation.